Welcome to the Posture Performance Podcast, improving the intelligence of the body. Here we will talk from our experiences as fitness trainers, movement specialists, performance therapists, and educators to give you, the listener, an effective approach to get your clients healthier and stronger. We are your hosts, Bryce Turner and Laura Mastrodotti, and this podcast is for you. In this episode, we're going to discuss the different fundamentals of how to keep longevity in your spine by utilizing ELDOA, the benefits of the aging spine, and how to correct those pathologies that a lot of times we deal with. So tune in, check out what we have to say, and we look forward to seeing you at our next podcast.
Hi, everyone. Finally, Bryce is back from Korea. Okay, so finally, because in the last episode I talked by myself and I feel alone. Okay, so today is our topic, Bryce, because it's ELDOA and the longevity of the spine. Okay, but we wanted to say to our listener that in this episode we don't want to talk just to the ELDOA community, right? We want to keep it simple and to talk to everyone. For example, let's say that maybe someone is following our accounts, your accounts, my accounts, whatever. Maybe is following the hashtag back pain for some reason. Maybe they don't know what ELDOA is, right? And we will explain how it works and keep it.
Yeah. No, I mean, I think probably the most important population of people that we talk to are the people in need, which is a lot of our patient client population of those people who don't know. They don't understand. They're learning about their bodies and about their spines. I feel like half the time when I'm working with my patient population, I'm educating them on their body so that they have a better understanding of what it is that we're trying to accomplish in our sessions, so that they have better application of not only their own exercise, but they want to follow the programming because they understand the approach.
Yes, exactly. First of all, I have a question for you and for myself. My question is, in our 20 years experience, how many patient clients did you meet entering from that door, your door, saying, "Hi, I'm here because I want to prevent back pain"?
Yes, I think most of them. A lot of them come in here and they're in back pain, and because they're in back pain, they are constantly trying to figure out ways to heal that back pain.
But not because they are in back pain. I mean, I'm here, super healthy. I want to prevent back pain because here at my studio, no one entered with that goal. They enter here because they want me fixed their back pain.
Yeah. And you know, a lot of times because from our model of exercise or therapy and the approach to the body, you know, you're in Europe, so it's a little bit different, I think, from some of the mentality where the osteopath world is a little bit more prominent in regards to how a traditional osteopath would operate. Whereas here in the States, osteopaths are completely different. And we've talked about that in some other conversations where they follow more of a typical medical practice, right? So they practice like an MD. They don't do the manual therapy. They tend to be more holistically minded. So they're looking at, you know, sort of this overall function of the body, and they look at, you know, diet and nutrition sometimes, and they try to do maybe some hands-on work, but really they're following more the model of the MD, which is to prescribe medications. They spend very little time with their patients and their clients. And so you don't have that same approach here in the States.
Yes.
And so the traditional model is to see the doctor, see the orthopedic, go to the physical therapist, or you're on drugs or you have surgery. And those are the options. That's it. And you have to find and navigate yourself as a patient to find all the things in between, whether it's working with a positive like chiropractor or a manual therapist or a specific physical therapist, or even working with a high-level trainer or somebody that basically is doing the work that the overall umbrella of healthcare isn't addressing.
Yes. But tonight we want to talk about aging, the aging spine. And first of all, we have to say that aging is a normal process, right?
Right.
Of course. Right. And very
But
often,
it happens at different rates with different people.
Exactly. Very often, but I mean, here and there and etc. is almost the same. Very often there is a lack of movement, lack of exercises, right? And when you lose your mobility, you are in trouble.
Yeah.
Right.
Yeah, that's probably one of the number one things is as your body moves less, the less ability for the tissue to slide and glide or the joint to move. You have this exponential, we'll say a travesty of the body, which is the fluids move less, you get more potential for inflammation, which in a long term setting is going to be a degradation of soft tissue, joints, the bone. You can get osteophyte growth from the bones not having the space around them that they need, where there's a lot of compression and tension for a joint.
We go back to this.
All kinds of things.
To this, exactly. And also, I mean, the spine, unfortunately, age like everything in our body.
Right.
Right.
Exactly.
Another number one, I mean, together with lack of exercises is, in my opinion, of course, compression. And we can do anything because compression is life.
Right.
Here on this planet, right?
Right.
I wanted just, before we start to talk about ELDOA, I wanted just to say, like randomly, 2 or 3 way symptoms, injury, not injury exactly, but way how did the spine age. And the first, I said compression, because of compression. Then I was thinking to disc degeneration. As I said, everything age in our body. And then I wanted just briefly to explain what happened, like when the space between a vertebra and another vertebra, we have the I want to keep it super simple, Bryce, okay?
Yeah,
the shock absorber disc between the two. Oh, I have a spine.
Hey,
what a
magic.
coincidence. What a coincidence. So disc, vertebra, and disc, and then these spaces, can you see that? Yes, you can see. The spaces start to decrease because the disc starts to lose water, right? And losing water, it starts to lose its function of shock absorber, right? This is one of the reasons, because the spine age. And another reason is here we have the facet joint, which is the joint of the spine that allow us to move, to flex, to extend, and etc. Right? And when it start to allow movement, when it start to age, maybe because of overuse, people that do the same movement because of job, for example, for all their life, right? So the facet joint are under stress, and they can get inflamed, right? And when and swollen, and etc. And when they are inflamed, for example, they push against the vertebral canal, so the space is narrow. Right. And this take me to another problem, which is typical when we age. When the space of the vertebral canal narrow, we call it stenosis.
Yes.
And that's a big problem when we age, right? And very often people have many of these problems altogether.
And so, you know, when you use a word like stenosis, it's kind of a catch-all word that basically describes any narrowing of any space for a nerve, right? So it could be the vertebral canal, as you said, and you pointed out in your model. It could be the foramen that's on the side where you get the peripheral nerve that's coming out of the spine. Anything that creates a narrowing effect. And so the number one cause of a narrowing effect, as you said already, is the dehydration or the desiccation of that disc. Whereas you lose hydration, the two vertebral bodies start to come closer and closer together because you don't have that pressure-filled system of the water inside the disc, right, to maintain the shock absorber property in the space. But the other things that are around that space are also the bone. And so as you narrow the bones together, they have a capacity to run into each other more. And when the bones run into each other more, that can stimulate more bone growth. And that bone growth can be described as osteophytes or bone spurring around the area, which can also lead to less space for the nerve to exit out, because as that bone is stimulated and it grows, it'll grow around that nerve space. The other things that are typically seen in those areas are what we say is hypertrophy or growth or swelling of the ligament tissue or the capsular tissue. So you have ligament tissue or connective tissue around the facet joint. If the facet joint is under load all the time because you have that compression, it basically swells that tissue. It swells the ligament tissue. And so because of that swelling or that inflammatory response around that part of the joint, you have less space. Or a lot of times it'll say hypertrophy of the ligament of flavum.
Yeah.
So that ligament is one of the connective ligaments between the two levels of the vertebrae. And again, if there's a lot of stress into that soft tissue or that connective tissue, it can also swell and inflame, creating less space for that nerve. So there's a lot of contributing factors to why you have a stenosis. It could be the disc bulging into that area, into the foramen area, or into the spinal canal area, which is obviously the number one result of a lot of times them saying stenosis. But all you need is something to touch the nerve for there to be pain, right? It could be the disc, it could be the bone, it could be the soft tissue, it could be inflammatory response in and around that area. And that's going to minimize the ability of that nerve to be healthy and to be pain-free.
Yes. And now we arrive to ELDOA. Okay, let's say, as I said in the beginning of this episode, let's say that we are not talking with for the ELDOA community, but for someone that for some reason is listening to this post and said, what is ELDOA? What are they talking about? So ELDOA, again, keeping it simple, it's a system of exercises, of corrective exercises. Okay, we are talking about this. We don't use any kind of machine or apparatus or stuff like that. The main goal is that to educate our clients to do it by himself, herself at home. It's just 1 minute posture. I say just, but we are not saying to these people that it's not so easy. It's super precise.
Right.
We want they perform it super precisely with super details and etc. And how ELDOA works, Bryce?
So to make it simple, as you said, it's an exercise to create space. So what we're doing is we're trying to create these elongated positions in the body to try to open up that space in a very specific way by accessing the connective tissue of the body, that connective tissue being the fascial system. And so as we create tensile forces or lines of tension in the body by the different reaches and postures of our of the exercise or the pose, we can specify where we want those tensions to go, or those lines of tension around the spine to go, so that we can effectively leverage open a specific level for a nerve or a disc between the two vertebrae. And without ignoring the lifestyle component of it, we need to also make sure that we look at functional posture throughout the day as far as what their everyday regimen is. How do they stand? How do they sit? How do they function their body? How do we create better awareness throughout the day so that they're not putting pressure on the body in some aggravating way? Because we're always going to have the factors of gravity pushing against us or our body weight. And then we have to make sure that we're hydrated. We have to make sure that we have a good system of eating, right? So that we can lessen any inflammatory response that a lot of times we can get even from our food. And then if we can condition ourselves in a way to do an exercise like an ELDOA, even if it's, the goal is always 1 minute or around 1 minute, that, even if we have to start in smaller increments and do shorter hold times, because that's what our body can do, our goal is to breathe, open up those spaces. By opening up those spaces, we're strengthening some of the muscular system around the body to help maintain that space. And then we're trying to increase the body's mobility at the same time, so that the connective tissue that tends to get tight over a period of time or because of trauma that instead of protecting that area of pain, we're allowing that tissue to now move. And as that tissue increases its ability to move, it's helping to draw the fluids into that area. And as we draw fluids into that area, we increase the ability of the joint, we increase the hydration of the discs, which then helps to create space for the disc or for the nerve. So those are some of the long-term effects, aside as like a lot of times, even when somebody's got acute compression on a nerve, they can do an ELDOA and get out of pain immediately just by doing one exercise. In more chronic cases, you know, it's something that we use the word to re-architect, right? To change the architecture of the spine and the soft tissue. And sometimes that takes a while. You know, if you've got a lot of chronic dysfunction in the body and you've lived that way for 20, 30, 40 years, it's going to take some time to unwind all of those things to try to alleviate any of those compressive forces that we tend to have around the nerve area. So the ELDOA is going to be one of the most effective exercises because it's an active exercise to, we say decoapt or to open and separate, but most people identify with the word to decompress or to open up a space or to take pressure off a nerve. And there's a lot of therapy techniques that are out there that are very passive in their approach to decompress the spine to try to create space. The difficulty with anything like that also can be effective, but because of its passive nature of the body, we're not specific enough. So if I have a compressed area, that compressed area tends to be very tight and it tends to be very fixed sometimes together. If I don't have a compressed area, that area tends to still be very mobile. So if we think of the spine organized as a chain unit, and that chain unit is alternating between rubber bands and links of rope, if I separate that chain link, all the rubber band areas are going to stretch, but not the rope area, right? Because the rope doesn't stretch. So if I'm trying to work in an area that I'm very stuck and very fixed at in the spine where I have a lot of that compression or a lot of that tight tissue, and I can't open that up from a passive modality like a decompression unit, then I'm not going to really get a good result. All I'm going to do is stretch the areas that are mobile, and I'm never going to really open up with any permanent effect the areas that are very compressed and tight together where I'm having a lot of my symptoms from. So when we work with an ELDOA, we can work at those areas and be very specific and actively do it and get the body to be stronger and to stimulate the neurological system and to stimulate the movement of the tissue and get a better physiological effect for the body to create space rather than doing something passive that the body doesn't have any participation in, which is basically to stretch the body apart by some machine.
I want to get back to two key concepts, Bryce. One is the incredible specificity of ELDOA. And again, I want to keep it simple. This means that if one of our clients, a new clients, come to us and says that he has a herniated disc between L5 and S1, we have the exercise for L5, S1, and the same C71, and the same whatever in every single link. And this is crazy. It's never seen before in the fitness and rehab world. So I want to be very clear with this, okay? Because if we talk with people about fashion and whatever, maybe we are too, it's more for our pro. But when you say, hey, be aware that we have the exercise for that, exactly that spot, that link in your spine, they understand. And the other thing you said, the space. Again, when I briefly explain the first pathologies related to aging, like stenosis and etc., facet joint syndrome and etc., it's all about space. So if we are able, with ELDOA, we are able to create space. It's our
like
goal.
the cure for the spine.
Exactly. I was saying exactly this. So they don't understand maybe nerve root and etc. But if we say, okay, with that millimetrical space, because we are talking about a millimetrical space, it's really make the difference between pain and no pain. right?
Well, this is always sort of the argument for ELDOA, which is who shouldn't do ELDOA, right? Because it doesn't matter if you're a kid, it doesn't matter if you're in your mid, aged years, it doesn't matter if you're a senior. Why wouldn't you do ELDOA? Like, why wait till there's a problem, right? Because it takes more work and more concentration and more consistency once you have the problem, right? If you already have a disc problem and you've got pain or you've got dysfunction or you've got postural stress and things like that, the problem's already there and it's materialized and it's organized, and it takes a lot more effort on the rehab side to really relieve all that, which is, luckily for some of us doing the manual therapy, that's what the manual therapy is there for, is to accelerate the changes, right? And then back that up with the exercise. To do manual therapy without exercise doesn't make any sense, right? Because you need to have something that's going to help to prolong what that change in the tissue is. And if you can change that tissue with an exercise and carry on the manual therapy results, then you get a really good positive program for rehab. But the long-term effects, like my kids do ELDOAs, why not? Keep your spines healthy, work on your posture, keep the discs hydrated, keep the joints healthy. They're working all day long playing sports. And I think for a lot of us, if we think of our childhood years going into our teens and 20s and things like that, we live a very active, but sometimes physically stressful life, where we put a lot of demands on our body. And then everybody kind of jokes around as you age, like, oh, wait till you're in your 30s and wait till you're in your 40s and wait till you're in your 50s and your body just hurts all the time and you can't do anything. Well, if you took care of your spine and your joints during all of that time, why is there any reason that you'd be in pain or why you couldn't move your body correctly? There wouldn't really be any reason for any of that. So just as the longevity approach, like we're talking for the spine, really everybody should be doing ELDOA in some capacity because it's healthy for the joint and for the discs and for the spine. Why wouldn't you do it? That's the thing that when we look at our program and the growth rate of our program, like whether it's from the professional side, learning how to do these exercises and apply them into their client world, or we look at it from the patient side, like people should be looking for this every single day because they're like, hey, I want my body to feel good and I want to feel good the rest of my life. Why am I not doing these exercises? Or why isn't my therapist or my trainer not doing this program so that they can do those exercises with me so that I can stay more healthy? We need people asking for it, right? Because this is something that's such a big solution in our everyday world to keep our bodies healthy.
Exactly. The last thing that I want to cover super briefly, because we are busy, is to Dr. Boyer, which is the inventor or the creator of this methodology, always says that ELDOA is not stretching, but we are talking about strengthening exercises. And when someone take a look to our picture doing the exercise, they think that we are doing stretching, okay?
Right.
But I wanted to say that stay in that position absolutely strengthen your spine. And this is super important. This is super important, right?
Yes.
Okay.
Yeah, so, well, let me just explain it just real quick. Even for in layman's terms, to keep it simple, you have an activity of your muscle that when you contract the muscle, a lot of times we mostly think of contraction that shortens a space, right? Or shortens between 2 points. And there's a contractile force that we can create that we describe as extreme range of the tissue, which is a physiological effect. If you think about you're at home and you want to reach up on the shelf to get that plate off the shelf or a cup off the shelf or something that's high up on a shelf, and you're reaching and lengthening through your body to try to go get that, that's the physiological effect of the contraction of the muscle actually elongating that muscle fiber, right? And so as you elongate that muscle fiber, you're putting into an elongated position the connective tissue or the fascia. The fascia is all in length through all of our body, all the way from the crown of our head down to our toes, out to our fingers. It's like all one tissue around our body. And so if we can create this elongated position because of this contractile force of the muscle, which takes sometimes some practice, right, to understand how to do that, then we can create these lever arms to from tension in the fascial tissue or the connective tissue that then helps to open up that space. And so we're improving the system globally throughout the body to create a better connective tissue or a fascial tissue system, which is all of the link of our body where our organs are connected to it, our bones, our muscles, our veins, our nerves, all of those things. And then we also have this analytical or detailed, very specific result, which is to effectively create space, which is to increase the health of all of our joints. The detriment of every joint is dehydration, stress, and compression. If we're not hydrating somehow or moving the fluids in our body, that's a problem. If we're under a lot of stress, our body tends to be more tense and tight, and we don't move the same way. And if we have a lot of compression around our joints, there's the physiological effect that we're going to inflame or change the articular surface or change the bone or anything like that because of long wear and tear that joint may withstand. So again, physiological or physical longevity, like one of the big components that we should always think about is that ELDOA is part of that.
Okay, let me think with saying something, and I will close this episode with a question for you and for myself. So I want to say this that probably will sound like a promo, but I don't care. As you know, I'm without any kind of shame.
Yeah.
So yeah, so I want to say to who is listening to us that there is a list of official instructor like you and trainers like me, ELDOA instructor, ELDOA trainers like me and you, and on www.eldoavoye.com they will find the worldwide list of us, okay, and they can study with people like me. I'm here in Italy, but I teach everywhere in the world. And if there is a professional that want to do our job, they have to come to people like you, for example. And we are recording, so you can tell me anything. I can say whatever I want. And I want to really recommend people like you. I want to recommend you and your generosity and your skills and whatever, and your knowledge. And
Appreciate that.
I'm recording, so you can say anything.
Yeah, no, all I want to say is that, you know, there's a small population of instructors around the world, and most of them are concentrated in the United States. And I've really taken it upon myself to try to grow that population of education, which is I've been traveling to Asia over the last year to try to bring ELDOA into that market. And to try to improve what it is they already know, because they're a very active and exercise-centric population of people that, you know, everybody suffers from these things. I'm going to be going to Brazil later this year to try to, for the first time, bring this type of education down into South America. And we're going to continue this effort the entire time to try to continue to grow the program, because this is such a valuable tool that I use every single day in my practice, whether it be from a therapy approach, an exercise approach, performance approach, pain management. It depends on how you really want to apply an exercise like this. But for my own testimonial, I use it with my kids, because my one kid had some scoliosis that he's completely corrected on his own by doing these exercises. I do it for myself. I've got 3 herniations in my neck. If I didn't do my ELDOAs, I'd be in a lot of pain and I couldn't do my job the way I want to. But I see it every single day helping people. I always kind of test the model, right? I look at it and I go, is this really going to work? Right. And I haven't had a situation when we've had consistency to do this type of work that, that it hasn't gotten a good result.
And so even here, my clients are from kids, as you said, to 80 and whatever, and they do their best, and they do their exercises, they do their homework, and they're great. They feel great, and that's also. I mean, before ELDOA, we used to teach different things, right? Pilates and stuff and whatever. And then when we met in different moments of our life, ELDOA, it definitely changed our professional life completely.
Yeah, 100%.
Okay, I have a question for you and for me, for myself. So, what is the ELDOA posture that promotes longevity? The most. It's a stupid question. It's a stupid question.
The easy answer is L5S1. Right. So L5S1 ELDOA is an ELDOA that although it's for L5S1, which is the base of the spine, because of its non-loaded posture and the elongation effort that we create in the spine, it's good for all the levels of the spine. It's really actively trying to open up all the levels. So if there's one ELDOA that I prescribe to anybody, usually on day one, no matter what their problem is I give them an L5S1. And if there's one posture that I have patients and clients come back to me and say, I love doing this ELDOA, it's L5S1 because it makes them feel so good.
I agree with you, but I would answer also the general ELDOA, the so-called general, which is super sophisticated, and maybe we will talk about this in another episode because it requires an episode, that exercise.
Right.
We just say that it's not an ELDOA for one target vertebra. It's something that regards it's more close to the osteopathic
principles.
Exactly. Okay, Bryce. Exactly. That's it.
Hey, this is great.
See you the next month on May.
Yep, definitely.
Okay. Ciao.
Okay. Ciao.